Hello everyone, welcome to CAPSA. Today's topic is tricyclic antidepressant. Okay. So we need to know some brief history of tricyclic antidepressants. Okay. In the 1950s, these drugs were clinically used first, that is imipramine. And in the 1961, amitriptyline was synthesized from imipramine. Due to some severe side effects, they mainly come under the second line of treatment for depression or dysphoria. Among all the tricyclic antidepressants, it is assumed that nortriptyline is safest due to the absence of sedative effects. Now, what are the classification? So, based on the structure of amine groups, it is of two types: tricyclic secondary amines, nortriptyline, decipramine; tricyclic tertiary amines, imipramine, amitriptyline. Okay. Based on the selectivity of NET and SERT transporter, what do you mean by NET and SERT? NET is norepinephrine transporter. Okay, and SERT is serotonin transporter. Okay, when it only inhibits NET, that is decipramine nortriptyline. When inhibits both NET and SERT, that is imipramine and amitriptyline. Okay. Now, what is the mechanism of action of tricyclic antidepressants? TCAs actually blocks the reuptake of serotonin and norepinephrine by the presynaptic neurons. Okay. Thus, it increases the concentration level of these neurotransmitter in the synaptic cleft, and obviously, as a result, availability in the postsynaptic receptors and increases the mood changes. This mechanism of action we will understand through a picture. Okay. This is one neuron, and this is another neuron. This is the junction. Okay. This junction is known as synapse. Okay. This is the presynaptic neuron. And this is the postsynaptic neuron. Okay. Now, these are the neurotransmitter, okay, which comes from the presynaptic neuron. If this is the norepinephrine or NE, this is the serotonin or 5-HT. Okay. These are the neurotransmitter present in the postsynaptic neuron. Okay, neuroreceptors. Okay. So, neurotransmitters like noradrenaline and serotonin, it comes from the presynaptic neuron to the postsynaptic part, where it binds with these postsynaptic receptors and shows the action. After showing the action, these neurotransmitters are taken by the presynaptic neuron. This reuptake process is actually blocked by tricyclic antidepressants. Okay. Now, what are the pharmacokinetic parameters? Actually, it is absorbed through the oral route and shows the high fast pass metabolism. Okay. Shows the greater volume of distribution and highly protein bound. highly protein bound. Metabolized obviously through the hepatic metabolism and by using the cytochrome enzymes. All of you know cytochrome enzymes, okay? And it follows actually three processes. One is oxidative demethylation of the side chain. Another one is hydroxylation of the ring structure. And another one is conjugation. Followed by these three processes, hepatic metabolism is done. Okay, eliminated through the kidney and shows the elimination half-life 8 to 36 hours. Okay. Now, what are the drug interaction? So these are the name of drugs and their effects. When it binds with the phenobarbital, plasma concentration of tricyclic antidepressant decreases. Okay. When it binds with the ethanol or sedative hypnotics, CNS depression increases. When with anticholinergics, actually it potentiates the anticholinergic actions. With antipsychotics, obviously first generation antipsychotics, synergic effect occurs. Okay. With carbamazepine, vertigo and tremor happen. With barbiturate, stimulate the metabolism of tricyclic antidepressants. So these are the effects and these are the name of drugs. Now what are the adverse effects? It shows atropine-like effects, that is xerostomia, blood vision, constipation, urinary retention. Xerostomia means dry mouth, okay? Dry mouth. And also shows alpha-1 adrenergic blocking effects like postural hypotension, tachycardia, cardiac arrhythmias, okay? And also shows H1 blocking effects like sedation, confusion, and another one is weight gain. Now, what are the therapeutic uses? It actually uses the treatment using the treatment of severe depression, for the treatment of nocturnal enuresis in children, also known as bedwetting, and for the management of chronic neuropathic pain arises due to migraine, in the treatment of panic disorders or phobia, and for the treatment of bulimia nervosa. Bulimia nervosa is occurred in a patient when the 5-HT level decreases. Due to decrease in the 5-HT level, a patient feels constantly uncontrolled eating followed by vomiting. Okay. So these are the therapeutic uses. Thank you for your attention.